Youth are very important when it comes to healthcare reform efforts because, of course, our young people are our future. When you look at the type of, and I'll give you an example, sexually transmitted infections, we have to have comprehensive sex education in our schools. And that's part of a public healthcare option and plan. And so young people need to know how to prevent diseases, and they also need to know how to stay healthy. And part of that has to do with healthcare reform and putting resources and funding initiatives on the preventive end for children's health care and for young people's health programs. We can't lose hope. We all are worried about that, but part of what we have to do, and that's what a movement has to happen, and why a movement has to happen, is to make sure that, first of all, we create an economy that allows for retraining and rehiring of those who have been laid off. Many more people now are losing their health care insurance, and young people naturally are very anxious about this. But we can't lose hope, we can't give up, because we have a president who gets it, who's really making some inroads, and it's going to take a while to turn the economy around. But I think we've seen that he is bold and he's audacious and he's making the right moves. We're working on health care reform, and I know we're going to do the right thing. And so young people have to get organized, stay engaged in politics, because elected officials respond to the voices of their constituents. And so it's important that young people's voices are at the top of those yelling and screaming about what needs to be done.